This episode of The Heart of Healthcare is brought to you by FlexSpa, the future of healthcare connectivity. Are you building a digital health platform? FlexSpa is here to help. FlexSpa simplifies patient onboarding, clinical trial participation, benefit administration, and plan enrollment with instant access to claims records, full payer coverage, and digital consent management. By integrating with FlexSpa solutions, developers can modernize their patient record retrieval, understand healthcare utilization and costs, and deliver truly personalized healthcare experiences. Head over to flexpa.com to learn more about what they're building. That's FLEXPA.com. Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all.
Hello, listeners, and welcome back to the Heart of Healthcare. I'm your host, Steve Krause, and today I am very excited to have a friend, Dr. Patrick Conway, on as our guest. Hot off the press, Patrick, after a long, distinguished career in healthcare, we're going to talk about it, was recently named the CEO of Optum, United Health Group's health services segment. In addition to his many roles at Optum, Patrick was the president and CEO of Blue Cross Blue Shield North Carolina, so he has experience running a major Blues plan, and then is also widely known for his work at CMS, where he oversaw the Center for Medicaid and Medicare Innovation, along with a number of other roles there, and was frankly a leader on the national level in terms of the movement towards value-based care. So Patrick, thank you so much for coming on. I really appreciate it.
Yeah, Steve, thanks for having me.
One of the good guys in our industry who has always been there when we've called him. So I do appreciate it. Patrick, I want to go through your career, but Optum, a well-known player in our industry, in its name, in its size, in its scale, in its impact. But I don't think people really quite know what Optum does. If you were talking to someone who wasn't as educated in the details of healthcare, what does Optum do?
Look, at its core, Optum, we have almost 300,000 teammates, employees across the country and internationally, and we're delivering healthcare to people. So we serve over 160 million people across the nation. We've got Optum Health, which is our care delivery arm, in clinics and homes, mental and behavioral, specialty care, array of services, federal health services, and Optum Health directly delivering care. So we got lots of doctors, nurses, others in homes and clinics delivering care. We've got Optum Rx, which I worked with that team for the past 2 years, delivering both pharmacy benefits, so benefits in the pharmacy space to over 5,000 clients, and also direct pharmacy services. So Optum Health actually serves a little over 100 million people. Optum Rx serves about 62 million people. And obviously, some of these people are served by multiple parts of our platform, and that's when we really deliver that integrated care experience, which is what we're striving for: medical, pharmacy, mental, behavioral, social care. And then the last part of the platform, if you will, is Optum Insight. So our data technology business, partnering with health systems, payers, others across the system to make the system simpler, better experience, and more efficient. And so that's Optum in a nutshell. It's an amazing team. I'm honored to serve now as the CEO.
I want to go back to younger Patrick, who I think was...
I am getting older. Thank you.
You look pretty good. But I think started off wanting to be a doctor.
I'm still a doctor.
Still a doctor. Sorry, you're not. You don't play one. You actually are one. I actually believe you still practice, if I remember correctly.
I do still on weekends at a safety net hospital in Boston.
Boston Medical, which is amazing. I actually want to talk about that. But how did you get from there to here?
It was a long, winding road. Look, I've had, grew up young as 4, parents stressed education and service, got a scholarship to go to Texas A&M. Went to McKinsey Consulting as my first job because I wanted to learn healthcare. I was going to do Peace Corps, Teach for America, direct to med school or McKinsey Consulting, which is pretty odd 4 things, but made sense at the time. Went back to medical school, trained at Boston Children's and Boston Medical Center. So the pediatrics program is actually combined. Met my wife then. That's why we live in the Boston area with our 4 kids. And had a couple step change sort of opportunities. So went to Children's Hospital of Philadelphia, then Cincinnati Children's. Then I did a White House fellowship in the Bush administration for Secretary Leavitt. And then he asked me to stay on as his chief medical officer in Health and Human Services. So, of course, you're going to say yes to that. It was a great experience. He let me manage people, money, quality, learned a lot, still close with him. Then went back to Cincinnati Children's and ran one of our largest divisions and ran quality innovation. And, I was hoping to be a Children's Hospital CEO at that point in my career. And then I got a call from Secretary Sebelius and Don Berwick at the time. Said we heard one of the 2 jobs in D.C. you'd come back for is Chief Medical Officer for CMS, Medicare and Medicaid. And so I came back in 2011, ended up spending 6.5 years, as you said, ran the Innovation Center, deputy administrator, then principal deputy, then acting administrator, acting because I was never political with people you've probably had on the show. And then North Carolina, as you said. And then, Optum, I love scale and I love trying to have an impact with teams. And so Optum and United Health Group is just an amazing opportunity to, at scale, try to help make the health system better. And so that's what gives me energy. How do we work, whether it's medical care, pharmacy care, mental behavioral, how do we make the system better? To bring it back to your question on hospitals, I see that when kids fall through the cracks and get hospitalized, it's usually some challenge or failure in our system that allowed them to get hospitalized. So how do we prevent that?
How do you think about your time in government? Now you're leading one of the largest healthcare organizations in our country. Like, you worked in both a Republican administration and a Democratic administration. Healthcare is a very political topic, as we've seen in almost every single election. And it's also an industry in America where public policy really drives a lot of change. So, like, what did you learn in your experience there, like that is affecting your role today in Optum?
Look, I learned a lot. I did not plan out my career. I haven't yet. Don't plan to start anytime soon. But I learned a lot. So a couple things. One, you understand the policy process and how's policy made? How does the policymaker think about it? That's useful.
Just out of curiosity there, because Bill Gurley did this famous podcast on the sort of incumbency advantage around regulatory capture, right? And so what for CEOs or for even innovators, right? For entrepreneurs, like what could you share that people don't necessarily appreciate about the policy making process and how to maybe influence it?
Look, the main thing I'd say is the following. The policymaker actually wants to make the system better, almost always. And they're trying to figure out a solution. So try to come in, listen to them, and help with those solutions. Many people come into CMS, and for 30 minutes in the briefing, they just tell you all the things they want. That's not that effective usually. What's more effective is actually engage in a dialogue. What's the problem the policymaker is trying to solve, or the congressperson, if you're on the Hill, then how do you help them solve that problem? Even we're going to talk about RX, I'm sure, during the call. We've tried to solve some of the problems in a market-based way that the regulators or the Congress or the states were trying to solve. I think that's a much better way to approach the framework.
Got it. So you said, understand the policymaker and kind of their goals and their motives and how policies
bring solutions. Bring solutions. You mentioned innovators. When my time in the Innovation Center, look, at that time, it was very early. We were working to set up ACOs and primary care models and state-based models, all these, an amazing team. And innovators would come in and give us ideas. And that was super valuable. And it would help shape our thinking. So, I hope companies of all stages are interacting with government. And I hope people in government are listening, because the key to good government is to actually interact with the market and external stakeholders and understand what's really needed, and directly with beneficiaries. So that's what I would share.
Any other lessons from that time?
Look, the Innovation Center, it was for value-based care, which I still work on today, and I did in North Carolina, and I did, that was the whole point of the CMS Innovation Center. How do you test payment models that improve quality and lower costs? Some things work well, some things you learn from. That's the nature of innovation. And there were, just to remind people, because sometimes the rhetoric around this gets interesting recently, whether it was pioneer ACOs or bundled payment for orthopedic procedures, there were a number of models that worked, were scaled into the program, and we need more of that. How do we test things both in the public and private sector and then scale?
Putting your physician hat on, you spent a lot of your life's work trying to make value-based care models work. and scale them now at Optum. What could physicians do better, or what do people not understand about physicians as they try to take on this value-based care new paradigm?
Yeah, look, we have we have physicians at Optum. My previous roles interacted with lots of physicians, including being one. I'd say a couple things. One, look, in this, physicians generally want to provide better quality care, manage their patient population well. I mean, I sort of assume good intent in life, and it usually is true. Then I think the question becomes, how do we help them do that? So, at Optum, we provide them tools, resources, data, a system to help them provide population health, better quality of care, better experience, lower total cost of care. And, we published data around this about decreased hospitalizations, decreased ER visits, better experience, better quality outcomes, literally better health outcomes. So, if you go to North Carolina and the work there, it was the same idea. How do I partner with the physicians in that case? How do I pay them? We called it Blue Premier there, in a value-based way. And those results, I saw the CEO in North Carolina the other day, they're still paying off. He was like, I think he said they were north of about $1 billion of savings now. So Kudos to him and the team that they've continued and that those results continue to pay off. Same in the Innovation Center. And I think, but you got to provide physicians and clinicians the tools, the data, the resources, the support to get there. Because otherwise, very early in my career, I worked in an FQHC I loved it, amazing experience. And actually I went back and did it again much later on. Super hard. Because
they just don't have the infrastructure.
You didn't have the infrastructure. So you're doing the best you can to manage that patient with severe mental health issues or food insecurity, et cetera, at home, but they often don't have the resources to do it. So how do we provide the tools, the resources, the infrastructure to be successful?
You ran North Carolina, Blue Cross Blue Shield, North Carolina, which was, I'd say, a real early pioneer in value-based care and making some of these investments across a number of areas. Massachusetts, probably another blue plan, few others. Why aren't the Blues, in your perspective, doing more in this area? Is that fair to say? And if so, why not? Like, are there different market dynamics? Are there different Optum's obviously doing it, but like, why is it not more populated in some of the more blues plans across the country?
Yeah, let me briefly hit North Carolina, and then I agree we should, like all things, and friends with a lot of the police CEOs. Course, so I think directionally they're all trying to push in this direction. But North Carolina, just to give you some of the details that are interesting. So we moved from almost 0% in true value-based care models, so total cost of care, quality experience, to over 50% of patients, members, people in less than 18 months. It's now heading close to 100. It's 80+%. So you got to move people, whether it's public or private, into that kind of relationship. We also invested in primary care, major investments in primary care. We invested in integrated mental and behavioral health care. We invest in social care, so food, transportation, et cetera. Same thing in Optum. I used to lead our home and community programs, just to name one. Full risk care for duals. I love patient stories too. Sorry, Steve. And then I promise I'll come back to the Blues. But you go on this visit, 91-year-old, 14 chronic conditions, dual eligible, so frail, elderly, low resource. Right. And we've now cared for her in the home, Dr. Debbie. And she has been hospitalized 0 times. She's like, I love Dr. Debbie. Dr. Debbie, by the way, is incredibly excited to be a geriatrician who provides this kind of level of care. And we'd helped modify her home. When her father died, we provided mental health support. That's good for that patient, and that's good for the system. So back to the Blues. The Blues and other payers have to incentivize that kind of payment model. They have to find providers to partner with, and they need providers who are willing to do that, to go back to your physician sort of health system that says, the way we should deliver this care is value-based care, focused on the patient, which is total cost of care, quality experience. And I think all of us need to go faster on that journey, because when we don't do that and it's, fragmented fee-for-service care, the patients suffer the consequences.
When we talk about value-based care, or you talk about value-based care, how do you define it, right? Because I hear you say 50% and 80% and 100%, but like, is that like, what do you mean by that?
Here's what I mean by value-based care. So that the buyer of care, the payer, and the provider of care, the physician group, the health system, it's focused on total cost of care, quality, so health outcomes, and experience, and it's a longitudinal model, so at least a year or longer, and it has some component of two-sided risk. We have learned and we saw this at the Innovation Center, and it's true in the private market as well, when there's only one-sided sort of upside, people don't do the investments and do the change at the level they need to. When you're taking a fully capitated rate or two-sided risk, all your incentives are aligned on how do I keep that patient healthy, out of the hospital, provide the best care possible. And just Medicare Advantage, I can't help myself because there's a lot of rhetoric around Medicare Advantage these days. Medicare Advantage, the core is 100% correct because the incentives on Medicare Advantage are total cost of care, quality, and experience. Of course, all programs, you can figure out how to make them function better. But the core of Medicare Advantage is how we should buy healthcare. It's, by the way, how we should buy it in the commercial market. To go back to Blue Cross North Carolina, we were trying to buy total cost of care, quality, and experience. That's what Optum does as well in the commercial market. And it's true in Medicaid. Value-based care, total cost of care, quality, and experience. That's what we do.
Yeah, where's Optum today?
Optum, we talk about our arrangements in Optum Health where we've got approximately 5 million people now that are in a total cost of care, quality, and experience model. And that's been growing typically north of 500,000 every year. So it's going to vary by the year. But, that is the largest population I'm aware of in a model that's total cost of care, quality, and experience. So on some level, when I talk to Dr. Desai and the folks in our Optum Health team, they're doing something at scale that no one else has done. And it's hard. I mean, they're putting together clinics, home and community, behavioral, and continuing to iterate and learn. And how do you provide that model at scale across different geographies? Because we're national in scope and deeper in some geographies than others, but it's a national platform. And so, that's where I get my energy.
Must be pretty cool to see the stuff you were working on in CMI at scale at Optum.
It's amazing.
Question before we move on to some of the other roles you had at Optum, where do you want to improve at Optum in terms of the value-based care health solutions? Like what are the next boulders to push up the hill on that front?
Look, first of all, it takes a team. I literally said my only job is to support all of you, and I'm in it. And look, to me, it's all cycle time, iteration, and improvement. So very early, we talk about Cincinnati Children's. There was a person named Uma Kodagal who did a lot of the training, and I said, you've trained thousands of people. What's the most important factor? Thinking it would be like education or team component, and she was like, cycle time. The faster you cycle, the faster you learn. That's the teams that do the best. It's still true today at Optum. The faster, or any job I've had, but the faster we can cycle, learn, improve at that team level and at the macro team, that's how you improve faster. So that's what we're trying to do.
How do you drive cycle time? I mean, that's music to my ears because that's what the best innovators do is cycle time. How do you drive in an organization where you said you have 300,000 teammates? Like how's that possible?
Yeah. Look, one, and it gets to the barrier, like I've cycled a lot. I've been in different roles, right? And people are like, man, the Patrick cycle time is crazy. Like I try to respond, like if they have an issue, they need a decision, and sometimes you need more information, but I try to get back super fast. And so I'm not the holdup. So I enable the teams. And then, you got to have teams. I'm one person. We have to have teams all the way to the front line, right? That frontline pharmacist, that frontline doctor, that frontline nurse who actually says, I can make the system better. Like when I have an idea or a change, it'll be listened to. So that gets to like when somebody sends me an idea, we follow up on it. And it may be, we can't do that, here's why. Or maybe we can do that, thank you. But like, it's all about cycle time and feedback and how you model what you want out of an organization.
So it starts at top.
Yeah. Although I don't think of it as hierarchical, I literally think my job is like, I try to think of like, who's the frontline doctor? And a bunch of them emailed me. And when the announcement came out, and how do I support them? Who's the frontline nurse? Who's the frontline pharmacist? And you can't meet all 300,000 people. Actually, at CMS and Blue Cross North Carolina, I met everybody at their desk.
Really?
True story. Yep. 6,000, both places, interestingly about.
Wow.
And I went and met them all at their desk.
50 times.
I can't do that at Optum. It's impossible. But what I do instead is I travel a lot, and I'll try to, in my last role, I go visit the infusion center, the home delivery pharmacy, and you talk to people, and it gives you a sense of what's really going on the front line, which I find, I find it incredibly energizing. A real story, I was in the infusion center, and I'm always like, what can I do to help? And and nobody says anything often. And you keep asking. And then finally this nurse is like, if only we could have a warming blanket for the patients. And so like that day we got our warming blanket. And that will, right? Like that spreads. It's like, hey, like if I say something, like it's like they're going to listen. And if they can solve the problem, they're going to solve it.
Let's shift to, there's so much I want to talk about. Let's shift to the PBM space. You ran Optum Rx for a couple years.
2 years, almost.
Listen, I used to invest in the therapeutic side. I now do healthcare services and technology. And kind of one thing that's remained true throughout my 20 years is like, it just feels like there's so much good that's done by the advancements in drugs and pharmacy. And like we're really lucky in the United States to be able to have these amazing medicines, you know, that are created, delivered, you can get them infused, what have you, right? And yet it feels like people feel like the whole system's screwed up. For people who don't understand the supply chain how do you explain the American drug system to them?
Let me, so first on the positive side, which you alluded to, I took care of kids in training with spinal muscular atrophy, Duchenne's muscular dystrophy, sickle cell, and still do.
Death sentences.
And now we literally have, for some of these conditions, cures. That's amazing. Right. We should all celebrate, period. And then on the supply chain, it's got to be affordable. Innovations that's not affordable doesn't help people. Very early on in my career, I had a child I discharged after a cellulitis, a leg infection, antibiotic, give it to the patient, comes back to the ER, 2-year-old, with the mom, really sick, septic, luckily did well. But I asked the mom, like, what happened? Well, I went to the pharmacy and it was $200 and I didn't have $200, so I was trying to get it. That's bad for the system. That was bad for the patient, bad for the system. Just, you got to avoid that. So then I can't help myself. Let me tell you some of the things we did to try to help with that. So then pharmaceutical manufacturers set the list price. Those list prices in the US are often 8 to 10x other countries. Then we do negotiate rebates or discounts on behalf of them. For Optum Rx, we were the first and only large PBM to date that we announced in January. We're going to pass through 100% of those rebates to our customers, employers, unions, governments, and we want them to, support their members, employees, et cetera, with those dollars. We're the only large PBM to do that. And the reason we did it, I want to remove any lingering doubt about our incentives. Our incentives are lower net price, lower costs for customers. Other thing in affordability, sorry, I can't help myself, I know, is just share 2 examples. Critical drug affordability. So it's now 290 plus drugs. So think asthma, diabetes, et cetera. Copay less than $30, usually $0 or $5. Evidence-based affordable medicines. In the specialty space, we built a tool called Savings IQ that uses data and technology and AI, but it finds copay coupons and other ways to lower people's copays, both within Optum and outside of Optum, and manufacturers. Saved $1.3 billion out of pocket for consumers last year. Lowered the median copay for specialty drugs, so think cancer, other things, to $5. Lowered the copay in cancer by 88%. And then to end with a patient story, I had somebody who emailed me who was a gentleman who said, I used to go on and off my cancer medicine and I would never tell my wife. And now it's $5 and I take it every month and thank you. So, that's why you do the work, right? It's the macro effects, but then you get a person example that is just so powerful of why it's important we do the work.
And as a leader in that space, how do you change the perception of PBMs?
Look, one, as I talk to policymakers now, they're actually recognizing Optum Rx is different. They're like saying it back to me. So we did 100% rebate pass-through. We also announced cost-based reimbursement for all pharmacies, all drugs, all clients, rolling it out. We should support independent community pharmacies. And we had independent community pharmacies in our press release positive about a PBM. That does not typically happen. And it's because we want to pay them and support access to medicines nationally and do it in a cost-based way, meaning cost plus a small margin for the pharmacy. And then the last thing, we got rid of 25% of reauthorizations, over 10% of prior auths, and doing all kinds of work to make prior auth, go from over 8 hours using AI to less than 30 seconds. But we need to do that at scale because if you're a consumer, if you get a very high copay, like the example I named, you're frustrated. And so how do we fix that across all the players so the medicines are affordable? Last thing I'll say, we started saying Optum Rx, and it would get said back to me now. We serve over 62 million people, over 1.6 billion prescriptions. Right medicine, right patient, right time, affordably. And actually, it drove growth. We grew 3 to 5x our competitors over the last 2 to 3 years. And I think it's because our clients and the customers were extremely satisfied with those results, that it was transparent, they had choice, and we were driving affordability.
I want to switch to Optum. One of the things that's always amazed me is like Optum is services United patients or members, right? But then you service other payers. You work with providers. Like, I don't get how you're able to be Switzerland in some ways. Like, I assume that's, got to be really challenging. How does that happen?
Yeah, it is challenging. But look, the way I think about it is the following. Let's go with payers for a second. We serve over 100 payers, and I need to treat them equally, if you will. And that's literally, and we have firewalls and et cetera. But if I'm thinking about United Healthcare or a Blue or another payer, I need to service them equally, meaning I need to help them deliver better quality, better affordability, better experience. And, Optum Rx is a great example. We obviously serve United. We also serve a lot of large Blues. We also serve employers, but it's all focused on the same principles. And we are very strict about that, if you will.
Because I imagine that trust is like, that's got to be hard. Like, I mean, United's viewed, generally it's amazing business, but it's viewed as like the big behemoth, the largest incumbent in our industry. Like that trust building must be challenging, I would assume.
It can be at times. I mean, it's interesting to me. So I've had Blue CEOs who I know say, oh, you must give United a better deal. I've had United CEOs of various business be like, I feel like you're giving the Blues a better deal. That's actually good. I want them both to trust us, and it means we're both servicing them in a way that they're questioning, am I getting the best deal, if you will? And our job to retain them or win business is to provide them the best deal, whether it's a payer or a health system or, anybody in the system. And so it's an amazing place. Our mission of United Health Group is to help make the health system better for everyone, which I love. You've got the component parts at Optum to do that, which we talked about: care delivery, pharmacy, data technology. When you put those component parts together for a Blue Cross plan or United or a large health system, you can be part of the infrastructure, the systems that they need to deliver on their goals.
I want to stick on one last question on your current role. I mean, obviously, your colleague was tragically assassinated a while back. Like, how do you process that as a leader in healthcare? There's a human element, but just how have you sort of led the organization through that? Because it was unimaginable what happened, and yet it happened to someone that you knew well and your colleagues knew well, and just walking down the street. Like, take me through that as a leader, how you deal with that.
Yeah, incredibly difficult. I mean, first, Brian, I was with him the night before, and we hosted dinner together. And most importantly, as you saw, the focus was on him and his family afterwards, as it should be. And then as you lead the teams, you have to be there for them, right? So people took different approaches, and everybody processes things differently, right? That's like the nature. And that is okay, by the way. We've all been through challenges, including me. And you have to process through them. What I tried to do with the team was support them. So, through calls, meetings, making sure they knew they had resources, if they needed resources, including mental health support, and supporting them through, we serve a ton of people across the country. And that's very important to continue doing and to continue doing better, because otherwise, somebody falls through the cracks, something bad happens. So we need to keep doing that. We all agree the health system has to be better. It's literally written on our wall. And so we have to do the daily work to make it real, true, and keep driving at it. So, you talk about age. I gave a talk, which I won't give the whole thing recently, but I was like, I've been doing this for like 25 years. And we're getting better, but not fast enough. I really
cycle
mean
time.
It. Like cycle time. Because sorry, I'm telling a lot of stories. I'll tell one more. This is going to make you sad, so I apologize. This is a while ago now, but it was I had a 14-year-old who had called over 100 mental health professionals and couldn't get an appointment and she was on Medicaid, really high functioning. Went to the top story of a third floor building and jumped off. and fractured both her legs. We fixed her legs, and we're trying to find her the right level of outpatient care in the mental health system. That should never happen in this country. So we have to have a better system that, whether it's her or one of our family members, which I bet many people listening have had, or themselves, that it's accessible, it's evidence-based, and it's available. So when people need mental health support, they can get it.
You referenced challenges in your career. We've all had challenges, right? As human beings, that's just, I think, the nature of who we are. What I admire about you personally is you've always stayed true to who yourself is. Like even showing up today after being named one of the most important positions in healthcare, show up to do this, and I appreciate that. But I'm curious, what are your tenets in leading through challenging times, either personally or professionally?
Yeah.
How have you kind of just got through it?
Yeah, look, I go back to principles and values. So first, when you have challenges, what matters is how you come back from it. How do you learn? How do you come back? How do you go to the next? And then I go back to principles and values. And you've heard a lot of them today, right? And I think they're consistent. Patient first. How do you make the health system better? How do you sort of cycle time and support teams? So for me, you also have to compartmentalize a bit if we're honest about some things. So, we got 4 kids, and it's incredibly important to me to focus on them as well. And so I'm regimented about time, if I'm honest. I'm regimented about time and organization. And I said it yesterday in a meeting. I'm like, I read whatever's sent to me. And I'm like, I'm going to read for every meeting. And I'm going to read whatever the materials were. And I expect everybody else to do the same. And that allows us to be efficient and effective. I try to listen well and then sort of collate the information. I mean, the reality of a decision gets to a senior leader in the organization, it means that, it's super challenging. And that was true at CMS too, right? You got a gigantic book every night that was literally 100 plus pages, and you would read for the next day. One of the hardest jobs, if not probably the hardest job I've ever had still. We'll see about this one. I'm just too new. But, and I think when you model that with teams and you get a high functioning team focused on the right set of principles and values, I don't know, that's when the magic happens.
You're a busy guy. You're on planes a lot. You've been busy for a long time. How do you keep sane?
It's not easy. I mean, am I saying no?
I think you are.
Yeah, I mean, it's hard. The balance part is hard. I do travel a lot. I wish I traveled less, but I don't know any other way. It goes back to culture. I like to be with teams. I like to see the things. I like to be with clients and customers. So yeah, I travel more than I would like. I did learn. I try to diet, exercise, sleep. I monitor the various things.
How much do you sleep a night?
I'm now trying to do 7 hours if I can.
I used to burn the midnight oil, but now I try to get sleep.
I did too. I used to revel in it.
Honestly. So did I. It was I wore a badge, and I realized that doesn't sustain. Yeah,
it doesn't sustain, and residency doesn't help. I was in the era of residency.
That's true.
I was in the era before
you probably
work
could sleep
hours.
Standing. You probably could sleep standing.
I mean, you do call every second or third night. I mean, that's ridiculous. They don't do that anymore, by the way, which is good. Yeah, so I try to take care of myself, get the support I need when I need it. And so, yeah, that's how I think about it.
Why do you still practice?
I love it. And
you do?
I do. Every year, I'm like, can I do another year? And I do weekends, so it's a little more sustainable. I don't do every weekend. I said this once to somebody, he does every weekend. I'm like, no, I don't do every week. So you space it out. I love it. So I come into the hospital and I'm with residents and medical students. And you take care of, 15 or however many families that were hospitalized, some with multiple chronic conditions, some with one condition.
Are you doing emergency med or hospitalist?
I do hospitalist now. So okay. I've done FQHC, I've done emergency, I've done ICU, I've done a lot of different stuff, but I do hospital medicine now. And I've actually done that consistently through my career. And, you help a family get better and go home. That's the most common outcome in pediatrics. And I'm at a place where the vast majority of almost all the patients are on Medicaid or uninsured. So you see the challenges in the system and you see where we've got cracks and we need to do better. And that helps me, I think, in my day job as well. We've got a lot of physicians and nurses and pharmacists at Optum. I do get emails and reach outs that they're like, please keep doing it. Like it means something to us that you still do. So I'll do it as long as I can. I do have to do all the board and CME and all the stuff everybody has to do. It's an honor to do it, honestly.
Really cool. We're in a new administration. And actually, I'm trying to see the bright side personally. I'll speak for myself, but I was at I saw a panel of a lot of folks and Anish Chopra, actually, who was a Democrat, basically said, hey guys, we can, wallow in our sorrows, or we can look at the opportunity. And the one thing this administration is probably going to be stronger on is just the private sector and maybe even the pace of change. To your point, cycle time. I mean, we've seen cycle time rip through the government right now for good or for bad. As you think about the current administration, what do you think are the opportunities?
Look, I think there's a lot of opportunities. So I know a lot of the people. I think they've put together a strong team at CMS, as an example, a really strong team. And I think they seem to be listening and interacting. That's positive. And I think when government works well, it's, they have to do their job as government officials, and we have to do our job of bringing them ideas and thinking about how the public and private sector partners together on various things, whether it's AI or the next generation of utilization management or the Medicare Advantage program. And so, look, I'm excited. I am.
What would be the one thing that you'd want them to see them do, whether it's with your Optum hat on or your former CMS hat on? Like, what would be the thing you'd love to see this administration get done in healthcare?
Look, I'm confident they'll do this, but continue the value-based care trajectory, like continue support for value-based care. I do believe that's also support for Medicare Advantage generally, because it is value-based care, and support for CMMI, which does value-based care. And the leader there, Abe Sutton, another great person in the line of CMMI directors. There's not a ton of us, and we all talk. And so I think that's probably the first. And the second, I know a little too, it's like the focus on the consumer. And by the way, these are Optum's focuses as well: value-based care, the consumer, system enablement.
What does focus on the consumer mean from a government perspective? I get it from an Optum perspective because you're a commercial enterprise.
So look, I was at something where Dr. Oz talked, and he talked about prevention, wellness, the consumer, utilizing AI to support people in their health journey. Like, how do you guide people to high impact, positive health trajectories, and not the opposite? I thought a lot of the things he said, and this was a big public forum, were right on.
We're at this moment where we have this fundamental platform changing technology that sits at our fingertips. We see it throughout the economy at Bessemer, including at healthcare. And traditionally, healthcare has not been very good at taking advantage of the prior platforms, whether it be mobile or cloud or the list, right? We've always been intransigent towards and adopting it. Like Optum, with your data insights, like how positive are you on the ability to use this technology to transform healthcare?
I'm bullish, and then let me even, like on the government side first, Chris Klomp, Dr. Oz, a number of them are talking about it, know more about it than I probably do, so that's the government side. Then within Optum, Sandeep Dedalani leads a lot of this work for us, but he's got thousands and thousands of coders and, very sophisticated AI people. And my son understands AI. I'm still learning.
At least you don't call it A1.
I'm not kidding. He's literally in some AI class, and I'm like, man, I should take this class. We're deploying use cases, across the company. So across all of Optum, across United Healthcare, across United Health Group. And it's everything from, administrative to experience to call center to, how do you inform clinical decisions? So how do you get the right information at the point of care? I'm incredibly bullish because, look, actually, let's come back to the practice and like the board things we do. I was in an era of you just memorize everything. There's no way that's the most effective, efficient system, right? A much more effective, efficient system would be providing me or any other clinician prompts. What you should ask? Should you think about that? I can still have the final decision, but it will make me, if used well, which I think we'll get right, it will make me or any clinical team better because they get the information, the insights that they need. And you're starting to see published literature on this that you may know that's pretty interesting. So I'm bullish on the impact, and I think goes back to cycle time. We got to iterate, we got to learn, we got to figure out what works. And I hope that we deploy the technology in healthcare to really drive sort of, not just incremental change, but dramatic sort of step change.
Final question. 5 years from now, what do you hope to have achieved in your new role?
Oh man, I never think about me. Let me do the broader. Me, I don't know. The company. The organization, yeah. Oh, that's a great question. I hope we've scaled what I described nationally and with significantly better results. Let me be a little more specific. Let me be macro and then a patient. So macro, quality, health outcomes are significantly better and you've got demonstrated results. Experience, net promoter score, CAPS, all the measure experience, like significantly better. Like, they're high across the board because it's, so positive. Interestingly, by the way, in RX, even though there's rhetoric around it, our satisfaction for our clients is greater than 90%, by the way. So it's quite high. And our retention rate is over 98%, which tells you they're happy. So experience, very positive. Total cost of care and affordability, we've literally on a national level leveled it off. So we say instead of when is Medicare going to run out of money, it's like, hey, we've got more money to invest. We flatten the curve. Same in commercial insurance, same in Medicaid. Pharmacy, we're talking about how some of the examples I gave you are true across the board. Like people are saying, we're having these innovative medicines and they're affordable. We've solved this problem. Social care, we didn't spend a lot of time on today, but whether it's housing, food, transportation, we've built a safety net together that does that. And then the data technology we hit on. I mean, I think AI 5 years from now, probably going to do things I haven't even imagined, maybe in 2 years. That's the cycle time. Yeah. So that's what I would want for the organization and for our country. And look, I'll say this. I think at United Health Group and Optum, we have in the private sector, we have probably the best chance at driving significant change to make the health system better for everyone. So we can truly help make the health system better for everyone. So what's written on your wall matters. That's what's written on our wall. That's the mission. Help make the health system better for everyone. I think 5 years from now, you'd look at that wall and you'd look at what we've done and you'd be like, wow, that's amazing. You're never going to achieve all of it, but you've made, dramatic step change improvements.
Well, Patrick, you have an amazing career. I've gotten to follow some of it. You're also a great guy, just really true always to who you are. And congrats on your new role again.
Thanks,
wish you great success, actually, because I do think what you guys do with given your scale will make an impact on healthcare, already does, and will continue to do so. So good luck. And thank you for coming on The Heart of Healthcare. I really appreciate it.
Thanks, Steve. Appreciate it.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and hosted by Michael Esquivel, Steve Krause, and Hallie Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.
Are you feeling stuck in your career or lacking employment at the moment? Experiencing symptoms of job dissatisfaction? You might be suffering from a common condition known as career stagnation. But don't worry, there's a solution. Monster.com. Monster.com offers a comprehensive suite of career-boosting tools designed just for you. Our free resume review and AI interview prep tool will help you stand out from the crowd. Need more guidance? Dive into our career advice articles for expert tips and insights. And don't forget to check out our salary tools to ensure you're getting paid what you're worth. Side effects may include a new job, increased confidence, and a brighter future. Consult Monster.com today and take the first step towards your new career. Ready for your next job opportunity? Visit Monster.com now.